Thank you, Mr. Chairman. Dr. McCants-Katz, one of the most important things we did in Cures was to create an Office of the Assistant Secretary of Mental Health and Substance Use, which is now what you've been nominated to head up. We need to ramp up our response to the opioid epidemic, and that means using every single tool in the toolbox. And one tool is to put more resources into mental health. So can I ask you to tell us why it is so important that we address mental health if we want to beat back the opioid crisis?
Yes, and thank you for that question, because there is such a very high rate of co-occurring mental disorders with substance use disorders. And the genesis of these mental disorders often predate the substance use disorder itself. And so we also know that if we do not address both disorders, treating one does not treat both.
Good. That's a very succinct way to put it, and I appreciate that. You know, it's clear that making progress on the opioid crisis means putting resources into treating mental health disorders. Medicaid is the largest funding source for mental health services, but SAMHSA has a number of other programs that help fund services that are not covered through public or private insurance. The Mental Health Services Block Grant and a group of other grant programs called the Programs of Regional and National Significance are SAMHSA's main mental health programs, providing funding for all 50 states and supporting the work of mental health agencies, of local governments, and of nonprofits who are working in this area. You know, these programs are absolutely critical to improving mental health in this country, and they serve millions of Americans. But let me ask you, Dr. McCants-Katz, is everyone who needs mental health care able to get that help right now?
I'd say the short answer to that is no.
No. And why not?
There are a variety of reasons. One thing we know is that a lot of people who we would say need this kind of assistance don't want it. But then there are also barriers that prevent people from getting the care and treatment that they need. It can be very difficult to access care.
Right. Do you have an estimate on how many people need mental health treatment who aren't able to get it?
I think our NSDA data told us somewhere around 12, 13 million people.
Yeah, that's really a stunning number. And now the Mental Health Services Block Grant and the Programs of Regional and National Significance are SAMHSA's two largest mental health programs. Combined, we spend less than $1 billion a year on those programs. So let me ask you, the White House Council of Economic Advisors released a report last month estimating the cost of the opioid crisis to this country. Do you know what figure they came up with?
I'm guessing it was pretty high.
It was pretty high. $504 billion. So think about that. The cost to this country annually of the opioid crisis is more than $500 billion. That's in 2015 alone. That's where we have the most recent data. And we are investing only 1/5 of 1% of that amount in helping SAMHSA tackle the mental health piece of this problem. I think we need to do more, and that's why I've called for an additional $1 billion of funding in next year's budget that would double the SAMHSA's budget and let them double what they put into the two largest mental health programs. Yesterday, the National Council, which represents 2,900 mental illness and addiction organizations, wrote me a letter, and I just want to quote what they said. They said, now is the time to support the highest possible levels of funding for health care programs in the federal budget. And today, this morning, the Massachusetts Association for Behavioral Health Care sent me a separate letter requesting that Congress double these funds. I could not agree more that doubling the funds for these mental health programs would give millions more Americans access to the treatments that they need, and it would start making a dent in the astronomical cost that the opioid crisis is imposing on our country. Thank you. Thank you for being here. Thank you, Mr. Chairman.